Good day, my name is Maryke Bronkhorst. I'm a dietitian in Johannesburg, South Africa. Today I would like to chat to you about nutrition during pregnancy. This is going to be a 4-part series. Today is number 1, which is the introduction. According to the Academy of Nutrition and Dietetics, there are 4 key points that we need to consider. These are appropriate weight gain, balanced diet, regular exercise, and appropriate supplementation. So how much weight should you gain? I think that is a very important question when we talk about pregnancy, because very often a lot of women gain too much weight, and that unfortunately is unhealthy for the mother and the child later on. So how much weight should you gain? If you are normal weight, during the first trimester, you only need to gain 1.5 kilograms. I find a lot of women gain more weight during the first trimester, and then they have to sit with the weight during the whole pregnancy. During your second and third trimesters, you only need to gain 300 to 400 grams per week. In total, you need to gain about 10 to 14 kilograms. If, however, you are underweight or overweight, I would recommend that you speak to your dietitian to work out exactly how much weight you should gain for your current weight. I think the biggest misconception about pregnancy is that women think they need to eat for 2, and that is absolutely not true. So what do you need to eat? It is important to try and eat a variety of foods, looking at the food groups. First of all, have plenty of fruits and vegetables. These can be either fresh or frozen or dried, occasionally a small glass of fresh fruit juice. I would recommend that you aim for at least 5 portions of a variety every day. For your starchy food, try to go for whole grains and low glycemic options. These are things like whole wheat bread, Provita, rye vita, whole wheat pasta, brown rice, potatoes, and my all-time favorite, sweet potato. For your protein, I would recommend lean cuts of meat and chicken, fish. Aim for at least 2 portions of fish a week. And eggs, pulses such as beans and lentils, those are all good sources. Make sure that you get plenty of fiber in your diet. This will help to prevent constipation and is found especially in your whole grain starches and your fruits and vegetables. For your dairy foods, try to include things like milk, cheese, yogurt. This contains lots of extra calcium, which will help you with a healthy pregnancy. I would also recommend to try and cut down on things like cakes and biscuits and fast foods, convenience foods, because these are generally very high in fat and sugar, and this can also help you to avoid putting on too much weight during your pregnancy. But how much should you eat? It is quite interesting to note that during your first trimester, you actually do not need any extra calories. You only need to try and increase your calories during your second trimester. So during your second trimester, you only need about 300 calories extra per day. And then during your third trimester, you need about 100 to 115 calories extra per day. You might ask, what is 300 calories? To give you a small example, it would be something like 3 small whole grain crackers, half an avo, an egg, and a glass of milk. And 100 calories is about 250 ml of low-fat milk. The third key point is exercise. So how much exercise should you get in during pregnancy? Ideally, pregnant women should get at least 150 minutes of moderate intensity aerobic activity every week. Lastly, I would like to touch on appropriate and timely vitamin and mineral supplementation. I would recommend to take a daily 400 microgram folic acid or folate supplement until the 12th week of your pregnancy. Ideally, you should have started to take the supplement even before you were pregnant. You can also try and eat foods containing folate, the natural form of folic acid, such as green leafy vegetables. Folic acid has been shown to reduce the risk of neural tube defects such as spina bifida. It is quite common for pregnant women to be deficient in iron during pregnancy, so I would recommend that you make sure that you eat plenty of iron-rich foods. You can also try to have vitamin C with these foods because vitamin C is known to increase the absorption of iron during a meal. If your iron levels are really low, your doctor would normally recommend that you take an additional iron supplement. Good sources of iron are things like lean protein, like red meat, chicken, pulses, fortified foods, and some green vegetables. Vitamin D is also essential during pregnancy. The best source of vitamin D is from our sunlight. In the past, especially in South Africa, vitamin D was fairly unknown, but especially in my practice and in the research, we are seeing a lot more people, and especially women, become vitamin D deficient. This might be due to the fact that we use more sunscreen. So when you apply sunscreen, it actually blocks about 99% of vitamin D into the body. During pregnancy, you should try and avoid taking supplements containing vitamin A or fish liver oil. Fish liver oil contain very high levels of vitamin A, like liver and liver products. If you have too much vitamin A during pregnancy, the levels could build up in your body and it may cause harm to your baby. One of my favorite nutrients are omega-3. And yes, I admit I might be a little bit biased. I did my master's nutrition in omega-3 and fertility nutrition, but omega-3 is such an important nutrient in our diet. According to research, omega-3 has a massive impact on the baby and the mother during and after pregnancy. So for the baby, it has been shown that omega-3 supplementation during pregnancy reduces wheezing and asthma, respiratory tract infections, increase IQ and cognitive developmental scores, increase immunity. It can actually reduce risk of allergic disease. It has shown to increase sleeping patterns, better sleeping patterns, as well as increase birth weight, a longer length, and a bigger head circumference. For the mum, it has shown that it can reduce your risk of postpartum depression. That is then all from me for today. I hope that the information was useful and that you will be able to have a healthy and safe pregnancy. Please join us next time where we're going to talk about the foods that you need to avoid during pregnancy, and I'm also going to touch on hyperemesis, which is the terrible morning sickness, and what you can do nutritionally to help you with that. Please follow me on Facebook or go to my website if you would like to get more information. Bye.